Villages, 1370 AM, 96.3 FM, The Source.
Minutes after 11 o'clock. Thank you for tuning in. Are you a people watcher, Robin?
Yes, I am. I'm fascinated by other people.
So then you probably enjoy the fact that we sit here each day doing this radio show, looking out the window at the walkway that enters into the mall.
I do.
And we get to watch people walk past, like that guy right there.
Yeah.
Who doesn't know I'm talking about him?
Yes, he does.
There you go.
He now knows.
And we see young people, old people, all kinds of people, right? In the morning, early in the morning, because we do the show from very early. You see a lot of people here at the mall before it opens. And they are here to do one thing, to look better.
Yes.
How? Because they walk.
That's right.
The whole purpose, and there's been a couple of ladies, and you've pointed them out to me too, right?
Yeah.
That you see and you're noticing a difference, right? You say, "Oh my gosh, look at, she's starting to look better. She's starting to look better, right? Isn't that what we want? We all want to look a little better, right?"
Exactly.
So let's talk about that. Dr. Dennis Schimpf is on the phone. He's a board-certified plastic surgeon and the founder of Sweetgrass Plastic Surgery. I always like that saying it. I like elongating that word. Sweetgrass.
Sweetgrass.
Yeah, anyways, book is called Finding Beauty. Think, See, and Feel Beautiful. Looking as great as Jennifer Lopez at 50 without plastic surgery. Dr. Dennis Schimpf. Good morning, doctor. How are you?
Good morning, guys. How are you?
Pretty good. And where are you?
Charleston, South Carolina.
How's business?
Good. We're growing, in terms of population, so that's always good for businesses.
A lot of beautiful people in Charleston now because of you?
I'm hoping a few more.
So what is the process like when somebody comes to you and you are kind of looking at what they have? You probably know right away what they want, right?
Well, sometimes, that's always an interesting question. We have people come in and say, you're the expert, what do I need? And
oh, no.
Yeah, right. And I'm really careful to say, it really is what you see in yourself and what's bothering you. And I write about that in the book. Ultimately, I could fix a bunch of things that I see, but if it's not what you see and what bothers you, you're not going to be happy.
So do you ever have somebody say, look, I don't like my nose, and you say, it looks okay? I mean, do you ever talk them out of it?
Yes, absolutely. Because once you go down that road, you're starting a slippery slope, and the last thing we want as doctors and surgeons is unhappy patients. So we really have to meet the patient's expectation with hopefully what we can deliver through a surgery or a procedure. Otherwise, they won't be happy.
And looking good is a lot more than just having plastic surgery. You have to have that inner metabolism. Larry had a news story this morning that Jennifer Lopez will be performing at the Super Bowl halftime show. And I mean, she's not just standing there. She's moving and dancing and doing all this stuff to look good.
Yeah, she's, obviously a tremendous example of good genetics and all those kind of things coming together, and obviously works extremely hard at her fitness and her conditioning level. And, she's a rare breed, but that doesn't mean that, everybody can't kind of be healthier and active. Like you said, just getting out and walking in the mall and being active like that alone will really, in the long run, make you healthier.
Tell us about the book. Does the book help the person make the decisions that would lead to eventually coming to see you?
Well, in some ways, but the book is more about, beauty is something that you feel. And, it doesn't matter how great you look or how great somebody else thinks you look. If you don't feel that emotion of beauty, there's no surgery or procedure that's going to fix that. And really want to convey that to the patient and the patient's family before they undergo a big surgery or procedure. Once they spend money and time and all that stuff and trying to improve themselves, if they're not ultimately, content in the end, then they're not going to be happy. And a lot of that discontent is from not understanding the goals and not understanding sort of the expectations.
It just seems that people that are between the ages of 40 and 60, those are the ones that go in for this type of treatment the most.
Well, we're seeing all ages now, honestly. We're starting to see, folks in their 20s wanting to get Botox and fillers. and kind of what people are saying preventatively treating themselves. And then we're seeing people all the way up into their 70s and 80s getting surgeries, liposuction, breast augmentation, facelifts, things like that. But technology is becoming better and less invasive, and so I think folks are more willing to kind of, put their toe in the water and kind of see what it's like without having to undergo big procedures. And I think that's really expanding our marketplace.
Is there a way for a person to see what they might look like an art? What do they have before a building is built? They have the artist's rendering. Is there something similar for what you do?
It seemed like he was outside traveling, like on a cell phone,
I
or
think
something.
He cut off.
I think he might have just dropped out.
That's why I love doing radio. I love doing this, Rob.
There he is. He's calling back. I think his cell phone dropped off.
There we go. I think we lost you. Are you there?
Yeah, sorry. I think this call got dropped. There is a way to do that with imaging, but you got to be really careful because obviously you can make a picture look any way you want.
I know.
And it's much different than skin and tissue and the body, the way it heals. So we do kind of different modeling with, for instance, breast augmentation. We try on implants that simulate what the implant would be like in the body. But I'm very careful with these computer generations of imaging. That's,
does the age of the patient, is that something that you need to consider?
Yes, I think the age is important for a couple of reasons. How skin responds and how it responds and how it heals is different, obviously, at different points in your age. And, we really want to be safe. So we have to make sure that patients are physiologically able to undergo the procedures. These are elective surgeries, so, you're choosing to do this. So we definitely want to try to make it as absolutely safe as possible and not take any risk.
And then it seems you also advocate for good nutrition and exercise.
Yes, nutrition is a huge part. So folks will come in and say, what can I do, to make this surgery go better? And protein is a huge part of wound healing, and so we really need them to have a good diet of protein and, eating healthy, and that's really going to help them heal. It helps their energy level, helps them get back up and moving around, and that's one thing that you can definitely control.
And are some people never satisfied? Do they always keep coming back to the point where it could be dangerous?
Yes, we don't see a lot of that, honestly. What we do see is folks do continuously want something else done. And as long as, again, it's within reason and we understand their expectations and we can meet those expectations, I think that's okay. But folks are definitely a little leery and scared initially of the whole process, especially when you haven't done something before or they've heard a horror story from somebody else's experience.
Does the book have pictures, or do you have a website that has pictures so people can see the befores and afters?
Yes, sir. The sweetgrassplasticsurgery.com site has before and after pictures. We do also try to put people in touch with patients who've had the procedure that they're considering so they can speak to somebody firsthand. And, the pictures, again, are very helpful, but they're not you. And so we want to, again, have reasonable expectations in what you're having done.
And I do love the caring that you exude within the pages of your book. You really are someone that really, truly cares, it seems. You're very genuine.
Well, thank you very much. I appreciate that. I really enjoyed the book because I tried to write things that I had experienced or seen, during my practice. And people, tend to do the same things over and over again and have the same sort of concerns and issues and those types of things. So we tried to convey that in the book and hopefully make people's experience better and the family's experience better with the whole process.
So I went to your website, sweetgrassplasticsurgery.com, and I noticed that we've only touched on a small part of what you do. You also do hair restoration. What is ketamine? What is that? Ketamine?
It's a medication that's administered from an anesthesia provider in our practice, and it basically has been shown to really help with substance dependencies, chronic pain, depression. It's sort of a disassociation drug, and it's used in anesthetics and it's been really successful. We've treated, military veterans to folks who've had substance abuse. It's really a pretty neat treatment. It's been around since the 60s and only recently seems to be gaining popularity again.
I went to the part where I have to enter my age so that I'm not a pervert looking at breasts, but
yeah, we have to be careful.
But yeah.
Nice.
See what I'm looking at here, Robin?
Yeah, I do.
Let me see what
That's great.
I'm looking at some more before and afters. Let me see. Smart Skin. Let me see what Smart Skin. Oh, I don't got to put my age in on that one. Oh, that's a big difference on the eyes. Yeah. Okay. Well, I would for the listeners, I would say get the book and also make sure you check out the website. That kind of will help you a lot. And you're not that far away, so if somebody who's interested in working with you would be able to travel up to, you'd say Charleston. Charleston, yeah.
Charleston, yeah. Yeah, it's a great place to visit. We'd love to have tourists come in and even just talk with you and kind of see what the game plan is for you and what the best options are.
All right, Doctor. Let's see. So we'll just leave the listeners, I guess, with that information. Do we have the book, Robin?
No, we do not. It's en route.
Okay, get the book on Amazon, and I guess you can get the book also on sweetgrassplasticsurgery.com. Is that right, Doctor?
Yes, sir. And there's an audio version, too, if you don't want the paper.
Oh, okay. Very good. Finding Beauty is the book. The website, sweetgrassplasticsurgery.com. Dr. Dennis Schimpf, thank you for taking time to be with us today.
Thanks so much for having me. Have a great day.
You're welcome. We'll be right back.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
On the first and third Wednesday mornings of each month at 9:05, Robert Colin will be with us from On Top of the World, Ocala's premier